quick overview of wrist mechanics. There are 4 primary motions of the wrist complex. Flexion, which is typically 60 to 80 or 90 degrees. Extension, which will be about 60 to 70 degrees. And then radial deviation towards the thumb, ulnar deviation towards the pinky, which are each 20 to 30 degrees on average at a minimum. And then there's a bit of pronation and supination in the wrist complex, which is not something we think of very much, but when I'm stuck with fixing a wrist arrangement, I might look at those motions as well. So if I diagnose that wrist pain or hand pain or any symptoms in the hand or wrist are coming from a wrist derangement, or if I hypothesize that diagnosis and want to investigate if that is indeed the case, then that indeed the patient has a directional preference of movement at the wrist, those are the motions that I will test, looking for how much range of motion the patient has and if it's painful or not. And in rare cases, if it's pain-free and moving well without weight bearing, so when unloaded, I might look at how the wrist is performing in loaded positions when there's some weight through it. But those are the rare cases. And importantly, if I'm looking at a directional preference movement and I'm not getting anywhere with typical repeated flexion or repeated extension or repeated pronation, etc., I'll often apply some traction to the wrist, which is visible to the naked eye when the wrist is separated. I'll add some traction before I use the repeated motion, either for testing or for treatment.